Welcome everyone to the first classroom session for the Collective Learning Certificate 1 Supply Chain for Health course. I believe that you have already started your course on the platform. And this session, this is the introduction session. So this will help you understand the overall course design. This session will also help you understand some of the components of the platform itself if they were not clear to you before. So we encourage you to pay attention so that you understand all the features of the platform, navigation around the course, and also at the same time, you can also get to know each other as well. Uh, there are about 25 participants in this cohort from various countries ranging from Asia to Africa to South America. So we have a very extensive geographical coverage this time. So first of all, good afternoon, good evening, maybe it's morning for some people. My name is Sanjay Saha. I'm the CEO of BSkill. Before we begin, I will just take you to some of the key points of this session. Then we'll quickly introduce ourselves, the key members of BSkill who are going to take this session, and then we'll begin with this session. So, like I said, this particular session uh, is about introducing the course. It's about introducing everyone, the participants, the instructors, and how to navigate around in the platform so that your learning is maximized. And we will also announce some competition leaderboards that we have on the course. So we will inform you about those as well. So some key points. So if there are any questions that you have when we are talking, when we are speaking, when the speakers are talking about the information, you can either put your questions in the chat, or if you want to ask a question which you cannot put on the chat, then you can raise your hand. We will, Andrea, Gilles, or myself, we will see who has raised the hand and we will give them an opportunity to speak as well. There are dedicated Q&A, question and answers section within the session. So you will be able to ask your questions then as well. The meeting has been recorded. We will be able to share this recording with everyone who may not be able to join this session now. So we will be sharing this recording with everyone. Then there are some polls throughout the session. Your inputs are welcome. Please answer those polls. Don't skip those polls. It will be good if you answer them. And of course, if there's anything which is not clear about this course, you want more information, please don't hesitate to tell us. You can again put them on the chat, or you can ask those questions directly to us, or you can also write an email to us or send your messages to either both of us, Gilles and myself, if they're related to content, or you can send those messages related to Andrea if they are related to the platform. If you are having any technical difficulties accessing the course, you can write to Andrea as well. So without wasting any time, I will go on to the next section, which is introducing BSkill, so that all of you know about this organization. And I will request Gilles to take you through this section. So Gilles, over to you. And maybe Gilles, as you start to speak, probably just before that, if you can also introduce yourself, and then probably Andrea can also introduce herself. Thank you.
Okay, thank you. So my name is Gilles Marion. I'm based in Paris. I'm talking from France right now. I am the Director of Education for BSkilled, and I've contributed to the foundation also of BSkilled with Sanjay. I have a background in supply chain, in health supply chain. I've worked in various sectors, in various places in the world, in public health, and with a very strong component of capacity building, capacity development, and supply chain. So we'll have more opportunities to know each other in the coming days and weeks. Please, Andrea, can you introduce yourself?
Yes, thank you, Gilles. Hi, everyone. My name is Andrea Crasta. I work as a project coordinator for BSkilled, and I am the community manager for the Hive. So I will be supporting all of you throughout the course duration. I am currently based in Bangalore, India. Thank you.
So, Gilles, over to you. Maybe I'll just introduce myself when I start to speak on a different section so that we don't waste too much time.
Okay, thank you. So please, let's go through the introduction of the courses that you are going to go through in the coming weeks. Sorry, first introduction of BSkilled. So BSkilled is coming from a vision of a connected health workforce. So connected health workforce is really bringing this idea of collective approach. So we believe that in the past, a lot of the capacity development or training opportunities have been very much focused on individual learning. So what we're trying to bring here is a transversal approach to learning, where people from various countries, various backgrounds, various organizations, or from various functions within the same organization can learn together. So really the tagline could be learning together as one. We believe that when we have one common understanding of what we're trying to achieve, with clear understanding of the various responsibilities and the various functions we're trying to achieve, this is a very powerful way to express and to use everyone's knowledge. So this idea of collaboration and learning together is a very important one, particularly focusing on the health, public health services and public health functions, where we know the impact that an effective health system can have on people's health. So BSkilled has been built on this premises, on this idea, and at the center of BSkilled is the Hive. So the Hive, to which you've all registered, is one place where all members of BSkilled, all the trainees, will be able to access various functions and various facilities. The main thing really with the Hive is this element of collaborative learning. There, when you go on the Hive, you will have access to various elements of knowledge management. So you'll have access to a lot of information, policies, guidelines. You'll have also an historical of all discussions which have taken place in the past or in the current course that you are following. So this knowledge management is really shaped also with the communities of practice. So you will see that through, when you're trying to access specific knowledge, you'll see that there are discussions on specific topics. You also have groups which are taking place where people can engage in a specific knowledge element that they want to discuss and which are of interest for them. So knowledge management, communities of practice. You'll also have the opportunities to have mentoring, supervision, and oversight. So it's beyond the immediate element of engaging with peer. You can also find dedicated mentors, or you can find specific experts, either in a very informal manner through the exchanges, the various forum and group discussions that can access, but also in a much more formal manner by engaging with dedicated experts that you would like to engage with. Competency-based learning, we want to develop all our training on very specific competencies which are needed for the sector. So in this generic course, which is open to a wide variety of learner and professional, we have developed the content of the courses on specific competencies that needs to be acquired across the board for public health. If we design specific courses for specific organization, then the competency we're trying to achieve may be a bit different. But our approach is competency-based learning. So we want to achieve specific competencies, and the content which have been designed for those courses are designed specifically to respond to these competencies. Professional social connect, as we said, it's a way to maintain interaction, to build also a professional relationship among people. We want this to be a social element. So if you have the community of practice, which are really oriented towards knowledge management, accessing content and resources, then you have also the social element. Sometimes we try to compare that to, sorry, we don't want to compare because we think we cannot be compared. We are unique. But if we want to compare, let's take Facebook, as a comparison to this social element. We want to build a network a bit similar to Facebook or LinkedIn, but with a very specific knowledge centered on specific knowledge and specific competencies. And then finally, the skills assessment. Through the Hive, you also have access to various ways of evaluating, making self-assessment of your knowledge and skills, and then being able, as the course curriculum will grow, as the course offers will grow on the Hive, you'll have more opportunity to access more courses. Just to mention that the Hive and BSkilled have been created in June 2020. So we are going to be 1 year old very soon. See that as the mark of a fresh approach. And yes, we know that we have to mature. We have more opportunity to get more mature with time. This is the second cohort, which is now taking place. We've already done one cohort at the end of 2020. And we also have been able to partner with various organizations to offer this approach of a mix between access to learning management system, and on the other side, a community of practice, a social network to be paired so that we have this collective learning together. So again, if we look at some of the four key elements that we want to bring, it's really making skills and connections. On one side, this knowledge, the skills, and the other side, the connections, the interactions that can help making those skills real in a real life with interaction. So yes, we hope to have a connection between fellow professionals from various regions. We'll try to have new competencies which are learned in a social environment, so not in isolation. Being able to provide local and global information and resources to everyone which is on the Hive, and then finally being able to engage in meaningful dialogue with peer and expert. So in a few words, those are the key features of the Hive that we hope you'll be able to access and that you'll engage into it, because the Hive, of course, there are some content which are already here, but the social engagement, the social value of it will really depend on the level of engagement that you find on it. So we hope you'll find the time and the opportunity to engage and have meaningful exchanges with your peer.
So thank you so much, Gilles. So at this point, I hope you have the participant list handy. I would request you to go one by one and invite our dear learners to introduce themselves. Just before you go ahead, so just a quick point on for everyone on what you can introduce yourself whichever way you want to, but some of the key information that everyone should know is one, where are you from, because like I said, we have an extensive geographical coverage, so we want to know, everyone should know where you are from. Second, where you are working, in which role, that is very important. And then, what do you expect from this course? You, or most of you must have seen that these questions were also asked on the platform as well. So I'm sure a lot of you have already read those responses from different participants, but it's always good to hear people say. So let me introduce myself as well at this point. I did not do it in the beginning, and then Gilles, request you to go to the list, and whoever is on the call, please unmute yourself and introduce yourself to the entire class. So my name is Sanjay Saha. Like I said before, I'm the CEO of B-Skill. I've been working in the public health sector for more than a decade now. I've been working for various UN organizations, central medical stores, um, NGOs, private sector in multiple countries in Asia, in Africa, and I have worked with people at the grassroots level, so working with healthcare workers, who deliver services at the forefront, and I have also worked with senior leaders of organizations, donors, and high-level UN leaders as well. So I've seen the entire spectrum, and throughout the experience that I've gathered, and with Gilles, we came up with this unique approach of developing capacity of healthcare workers through digital platforms, because we believe that digital is going to grow in the coming years, and this is the right opportunity to invest in digital in the health sector as well. And I'm sure a lot of you have already seen significant investments in digital mediums in your respective countries, but we feel that it's the right time to also invest for building capacities as well. So this is a brand new initiative that we have started. This is not a funded initiative, so we don't have any donor with us at this moment. Uh, but the way we are looking at it is, we want to make learning more accessible and more affordable for people who are living in Asia, in Africa, in South America, where there is an accessibility issue. So that is what we aim to do. And over the period of time, even beyond this course, because this is just one course that we have developed and we are bringing it to you, but there are other plenty of courses in pipeline. There are other new features on the platform which are in the pipeline, and a lot of content which you will receive even after you finish this course. And that's why, one of the emails that you may have seen is that this is the beginning of your learning journey with B-Skilled, and it will not end after 4 weeks. So it has just started, and as you are the members of the Hive, you will see more content, more courses, which will keep coming up over a period of time, and which you will be able to access them as well. So this is me, Gilles. Over to you for the introduction of everyone on this call.
Thank you. So yes, this is always a challenging exercise on Zoom to have everybody's introduction. So the name sometimes shift on the list, but we'll try to do it with a bit of method. And please, every time we hear you hear your name, please if you can put the video and start to present yourself, and as Sanjay said, tell us where you come from, your name, who you're working for, and that we'll be able to progress. So we will start with, and also please forgive me if I don't pronounce the name right. That will be the opportunity to get it right right from the start. So please, thank you. Let's start with Audu Tarfa. Audu.
Okay, thank you very much for the opportunity. My name is Audunu Tarfa. I'm in Nigeria. I studied pharmacy, so I have like 4 years experience in both hospital and then NGO work. Currently, I'm working with International Rescue Committee in Nigeria, Damaturu, Yobe State. So I'm very happy to be part of this group. Sorry because I am not in a office or room because I'm trying to reach home. So you just started with me. So as you can see, I'm outside right now. So I'm very happy to be part of this group, and I'm hoping I will learn a lot from my professional colleagues and my seniors. Thank you very much.
It's good to see blue skies, huh?
Yeah. Nice to see the blue Nigerian sky. So thank you very much.
Okay, thank you, sir.
Thank you. Can we move to Barbara Boni?
Hello, everyone. My name is Barbara Boni, and I'm from Haiti. So I've been working in the health sector for about 8 years now. So I'm responsible. I'm working for UNFPA, responsible for the logistics. So we are providing family planning and maternal health commodities to the country. So I'm working with the civil government and health sectors to help them to receive the commodities, like they can help the patients with what we are providing to them. So I hope that during the courses, I will be able to share my experience and also learn from what the challenges they have been facing and how to cope with those challenges. So I hope that it will be a nice environment and each of us will learn from each other. Thank you very much.
Thank you. Thank you very much, Barbara. Nice to hear someone from as far as IT here. So thank you. After Barbara, can we hear from Bikila Regesa? Bikila? Bikila, you are muted. Could you? Yeah.
Yes. Thank you. My name is Bikila Dereba from Ethiopia. I'm Public Health Emergency Supply Chain Officer at Ethiopian Public Health Institute and Ethiopian National Inventory and Distribution Team Lead of COVID-19 PP. I expect from this course, and there are many challenges around emergency supply chains, regardless of many challenges in the market. Broad expectation from procurement, how you can procure products national or globalization. I hope I gain detailed skills from around procurement, how you can procure supply chain management of products. Thank you.
Thank you. Thank you very much, Bikila. Thank you very much. Nice to have Ethiopia also on board. Can we hear from Shamini Karunaratne? Shamini.
Can you hear me?
Yeah, we can hear you. We can hear you and we can see you. So thank you. Please
okay.
go ahead.
Yeah, I'm from Sri Lanka. And actually, I got this great opportunity to become the part of this community and apply for this scholarship because of my current company. It's Bidita Private Limited. It's one of the largest cloud-based ERP provider in Sri Lanka. I'm working as a business consultant and business analyst for this company. Actually, in our major product one of our major product is ELMIS. It's called Intuition Vesta. Actually, it's mainly focused for vaccine logistic management system and contributing. I contribute for those systems and developing some apps and system developing projects which digitalize the supply chain management in health domain as which is the main focus area. And actually that's why our company CEO and my consultant advised me to join this program, and thankful them for them. As a business consultant, I would like to summarize my expectation of this program. I love to learn supply chain management for health from scratch and find opportunities where we can improve the supply chain for health, and where the opportunities to where we can improve in terms of digital transformation. And I would like to build the network and gain the knowledge and share the knowledge with peers in this platform. And also, as I would like to successfully learn this course and achieve the highest marks as possible as can. And okay, I'm really excited to working with you, learning and sharing the knowledge in this platform. Thank you so much.
Thank you very much, Shamini. I hope that everybody also is motivated by getting the highest mark on this course. But you'll see, Sanjay will explain you know how we organize that. So we hope that you all get very good marks. Thank you very much, Shamini. Could we hear about Yunwen Agai or Yunwen Rinda? Yunwen Agai or Yunwen Rida? Yunwen? Yes.
Hello. Can you get me?
Yeah, the connection is not that good, but we can hear you. Yeah, please.
Yes, I'm UN Hagai from Cameroon. I'm a pharmacy auxiliary. I work with the CBC head, that is the Cameroon Baptist Convention Health Services. And I've been serving the hospital pharmacy for more than 2 years now. And I'm very happy to be part of this lecture. And I hope to improve my skills on supply chain management.
Thank you, Ewan. I think the line is not that good, but I think we've heard you, so it was nice to hear you. Thank you very much.
For people who did not hear him, he's from Cameroon. He works with the Cameroon Baptist Convention. It's a faith-based organization, and I believe he's in the pharmacy services. But it would be nice, Yunwen, if you can also put your introduction in the chat so that everyone who's not able to hear you can also get to know you. Gilles, over to you.
Thank you very much. Can we hear now from Kenfrey Mutuma, please? Kenfrey Mutuma.
Yes, my name is Kenfrey.
Kenfrey? Sorry, you've been muted, I think, Kenfrey. Kenfrey, we can't hear you. Can you unmute?
Okay, maybe we go to the next one while Kenfrey figures it out.
Okay. Can we hear from for Wilson Hani? For Wilson Hani?
Yeah, good afternoon, one and all.
Good afternoon.
For Wilson Rani. I am a pharmacy technician working with a faith-based organization, that is the Cameroon Baptist Convention Health Services. I've been serving in this sector for almost 15 years, and I've been doing a lot of stock management, procurement, and I missed many other things just to make sure that the patients receive the best of care. At the moment, with the other colleagues, I'm happy to have them together so that we can move along to gain knowledge, that we can be able to add value to the work that we are offering to the patients through the CBC health services. And I'm grateful for the BSK to have given me this opportunity so that I can be able to learn from those who are ahead of me and those who are even behind me at the levels, so that I can be able to discharge duties that are better to fellow Cameroonians. Thank you.
Thank you. Thank you very much.
Maybe we'll try
Ken Frey. Can you come back? Yes, thank you, Ken Frey, please.
Pardon?
Yes, Kenfrey, over to you if you can introduce yourself.
Yes, my name is Kenfrey Mutruma. I am a pharmacist in Kenya. I work with the Ministry of Health and in a hospital in a county called Kajiado. That's a hospital called Loitoktok. I am a pharmacist. I am a hospital pharmacist and also sub-county pharmacist in charge of a larger unit or a group of facilities. And my expectations, I expect to learn a lot about bettering and improving my skills in terms of supply chain, how to overcome the emerging problems, and I'll be happy to learn from colleagues and the experts in the field. Thank you.
Thank you. Thank you very much.
Thank you very much.
Thank you. Yeah, from Cameroon. And still in Cameroon, can we hear from Nuidzele Alvin?
Good afternoon, everyone. I'm Nuidzele Alvin. I'm from Cameroon. I work with Cameroon Baptist, and I've served with them for over 6 years as a pharmacy assistant. I'm happy. I'm happy for BillSkip. I'm happy that BillSkip gave me this opportunity to be able to study from them and to learn more so that I can be able to improve on my skills. I'm happy to be among many people that can learn from them. Thank you.
Sheila had muted you. If you can unmute yourself.
Yes, thank you. Can we move to Princely, please? Princely Jemo.
Yeah, good evening. I'm Princely Gemo.
Good evening,
from
Princely.
Cameroon. Yeah, and I work with the Cameroon Baptist Convention Health Services equally. And I'm happy. It's a pleasure to be in a platform like this where you learn and interact with others around the globe. It's a wonderful opportunity. Yeah, I am a pharmacy assistant with the CBC Health Services. And I've been working in that position for about 10 years now, where I have the opportunity to be able to dispense to patients, work in the drugstore, and equally work in some HIV centers where we dispense ARVs to patients. So it's a wonderful time here, and I believe that in as much as we interact over time, I'll be able to learn and get some experience on supply chain management in order to help close the gap back in my own country and why not the world at large. So thank you so much. With that expectation, I believe at the end of the day, I'll be able to help my own country and even my institution to be able to make sure that we get the best standards and the best practices in supply chain management. Thank you so much.
Thank you. Thank you. Thank you very much. Can we move to Rahul Chandi Philip? Rahul Chandi Philip from India, I guess. Hi, Rahul, please, you can speak.
Okay, Rahul, you are not audible.
We can't hear you.
Maybe you can try without your earphones. Okay, we're not able to hear you, Rahul. Maybe you can figure out your microphone by the time we can ask the next person.
Okay. Can we hear from Wanjiru Njugi? Please, Wanjiru. I apologize for the name if I really don't pronounce it well. Yes, Wanjiru, please.
Hello.
We can't hear you. Evening. Yeah, good evening. Good evening.
Yes, my name is Wanjiru Jugi. I come from Kenya, and I'm working at the Ministry of Health at the Department of Immunization, and my core functions is based on health supply chain and also the access to vaccine to the public, especially the remote areas and rurals. So my expectations from this platform is to get to experience new challenges which are in global setting so that they can be able to expound our limits in our setting so that we can have better services. I'm also expecting to meet new people like tonight. This is a privilege from the tonight meeting, and it's an honor. So thank you.
Thank you. Thank you very much. Rahul Chandi Philip, can we try again you if your microphone is fixed? Okay. Rahul?
I think he's trying from a different connection now.
Yeah. In the meantime, can we try with Tata Stephen 4? Tata Stephen 4? Tata Stephens 4, can we hear from you?
Hello, good evening to everyone. I'm Tata Stephens 4. I work with the Cameroon Baptist Convention Health Services, and I've been working as a stock manager for 3 years. And one of my main aim is to do last mile delivery, and it is focused at the patient care at the last mile delivery. And one of the things I want to learn from this skill is getting more knowledge on how supply chain in public health management works, and to get better skills on how I can be able to improve public health punishment system. Thank
Okay.
you.
Thank you. But I think, am I mistaken if I say that for Wilson, we already, there is another four. There is another four.
Yes, he is using my microphone because network is a problem.
Okay, you are together.
We are together.
Okay, sorry, I didn't get that. Okay, now it's clearer. I was surprised to see the same name speaking, but with a different voice. So, okay, it's clearer. Thank you. Thank you very much. Rahul Shandi Philip, have you managed to get another connection?
I think it has been sorted now. Can you hear me, guys?
Yes.
Loud and clear. Thank you.
Perfect. Good to know that. Good evening, everyone. My name is Rahul. I am from India, but I'm based in Dubai, and pretty soon I'll also be migrating to Canada. I think among all the people who've been here, who are here, I am the only one probably who does not have any experience within the public health supply chain. I have worked within supply chain in the private sector. And I think I came across Sanjay during my master's when my thesis was in last mile data visibility in the public health supply chain. So since I've been working in the private sector, I've always had a very deep interest in the humanitarian sector. And after working on my thesis in the public health supply chain, I picked up my interest there. So if you ask me about the expectations for this course, I hope that someday I'm able to step foot within the public health supply chain sector. And I'm looking to make connections here, which is, I believe, the main purpose of the Hive, and also to learn from people who are much more experienced, and also to understand the basic minimum requirements expected of a professional within the sector. Thank you, and all the best.
Thank you. Thank you. Thank you very much. I think we've gone through everyone. I think someone else.
Just have one new person joining, I think again from Cameroon.
Someone
John.
else, yeah. John Richard. So, John Richard, welcome. You're just joining when we are closing down the introduction of everyone. So, please, this is the opportunity now to put you on the spot as you just reached. Sorry for that. If you can just give us your name, where you're coming from, your country of origin, where you're based, and the organization you're working with and your role. And maybe if you can just quickly tell us that, then we'll move on.
I don't think his microphone is working. John, Richard, we are not able to hear you. So probably if you can send us your introduction in the chat so that everyone can know you. Once your microphone is fixed, maybe it's coming back.
Hello, everyone.
Okay.
Yes.
Good evening. I am using for Wilson Granny's microphone.
Okay, please go ahead.
Because we got quite some network challenges. Yes, my name is John Richard Nguni. I am a staff working with a faith-based organization, the Common Baptist Convention. I'm a stock manager with 16 years of experience, and I've worked across a number of warehouses in this organization. My role has been a leadership role in stock management, and I've participated in coaching a number of personnel who are now also heading stores. And I'm glad for the opportunity that the Hive has offered me to gain more training so as to be much more performant, and also to pass on the skills to those who work with me. And within my organization, I have also participated in getting supplies come even through other faith-based international organizations that yes with us. So I want to find myself within the global supply chain, and so that I can be able to link up with other suppliers in other parts of the world and fit within the mainstream of the supply chain at a bigger level, so as to make healthcare delivery a much more successful goal for my organization and for humanity and life. Once more, I'm glad to be here, and I look forward to connecting to
many members around the world so that together we can be in a network and reach out to mankind. Once more, thank you to the Hive for this opportunity.
Thank you. Thank you very much for this declaration and this presentation. I think it's something that we all share. So please welcome everybody. Thank you. And please, Sanjay, can you take us to the next poll?
Yes. So before we move forward, there is a quick poll for everyone to understand your internet access. So I'm just launching this poll now. It would be nice to understand the internet access coverage from wherever you are. So you should be able to see the poll on your screen now. Please respond to that. Thank you. So this is the poll, which is on your screen as well. So as you are voting, let me take you to the next section of this presentation. But before that, there is a hand raised by Barbara. So Barbara, if there is a question or a comment, please, you can speak now.
I just wanted to say that I haven't heard from Untitled Chapter, so I just want to know where she is.
Barbara, we were not able to hear you clearly. If you can repeat.
I'll just say that I haven't heard that cluster. She's the only one that can do this action. Tell me, I said that I did not hear.
Barbara, can you, I'm really sorry, we're not able to understand what you're saying. If you can, please put it on the chat. We will then respond to you from there. So we have 11 participants who have voted. It seems about 7 people, they have a workable internet. There are about 4 people who have an internet, but it's not very fast. And we can see it from the Zoom meeting as well. But it seems everyone has some form of internet, which is good. So the reason why we are doing this poll is so that we can understand, your digital access, because that's one of the keys to finish this course as well. We have experienced that some people who have not a very good internet, sometimes they might struggle in the course. So don't worry. We will give opportunities, additional opportunities for everyone to finish your course as well. But it's important for us to understand the status of your internet connection. So Barbara is saying she has not heard from Andrea. So probably Barbara, you joined after Andrea spoke. So Andrea, maybe you want to speak again because you are an important member of the community of this course. So please, if you can introduce yourself again so that some people who have joined late may also know you. Please, over to you.
Yeah, sure. Hi, Barbara, and hi, everyone. My name is Andrea Krasta, and I work as a project coordinator for B-Skilled, and I am the community manager for this course. So that also means that I will be taking the course along with you all, and I will be helping you for the duration of this course. If you have any queries, you can reach out to me. Both administrative and content wise, I will put you in touch with the instructors. So that is what I will be doing. Thank you.
Thank you, Andrea. And Jill, over to you for this next section. Thank you. Jill, you are muted.
This next session is about the overall introduction to the course. So in the coming weeks, you're going to be going through the Collective Learning Certificate 1, Supply Chain for Health. It's a 4-week course with 25 learning hours. It's important, unlike some of the course you can access online, which you can do at your own pace and your own rhythm. This course is structured to be taking place in a specific duration and specific time at a specific speed. So the 4 weeks, in each weeks, there are some moments where we all meet together. We come with live courses, live classes, live exchanges, which makes it important to follow the rhythm of learning and getting the information in due time. So 25 learning hours, 4 weeks. It's following the European qualification framework, which is an evaluation in Europe of content of courses, which can help to understand the level to which the content is being developed. So if you look at the European qualification framework, you will be able to see what standard learning this course is referring to.
Sorry, we didn't mention it. This is a level 5 EQF framework.
Yes. Out of, Sanjay, 5 out of?
Out of 8. So there are 8 different levels. This is a level 5 certification.
Thank you. We also have the peer-to-peer learning, which we described in the introduction. Peer-to-peer learning will happen through the forum, through the group discussion, through the classroom live sessions, but also through some collective work and project that will promote throughout the course. You also have a learning competition, which should help you or motivate you to grow in the numbers. But again, as we'll present a bit later today, you'll see that it's not only individual competition, it's also, we'll try also to promote collective work in this competition. And finally, there is an international CPD certificate. This course has been reviewed by CPD Institute in the UK. So it's been also approved and recognized by an international body which can certify the content and the methodologies of learning. If we look at the learning outcomes, as we say at the beginning, we are mostly focusing on competency-based. So it's very important to develop the content. The content has been developed based on a list of expected learning outcomes. And so you have those 6 learning outcomes which are in front of you, but let me read them on top of you reading them. So at the end of the course, each learner will be expected to be able to explain the importance of supply chain in a health system and for achieving universal health coverage. You should also be able to demonstrate the complexities of a public health supply chain, should be able to discuss the key concepts, processes, and stakeholders in a public health supply chain, should be able to describe how quantity, cost, and quality of products can be managed effectively. You'll be able to explain the key downstream functions required to make products available to patients and identify the supporting functions which enable the supply chain operation. So as you can see, all this is really giving you, the key knowledge, the key concept, and some key tools also to be able to understand, describe, and probably also enhance, contribute to enhance supply chain in public health setting. Now, having looked at that, if we look at more practically how we are going to organize that over the next weeks. So the course calendar is starting on the 17th of May. and ending on the 14th of June. It's organized against 4 weeks. So I think you have all received the course calendar. Today we are 18th of May. We are the 18th of May, so it's the second day of the first week. Sanjay has shared a poll right now to make sure that everybody has reviewed the course calendar. As I'm conscious of time, I'm not going to go through all the boxes of the courses, but maybe I can highlight, some of the weekly meetings that we'll have, those yellow part, which one is taking place today, a 4 p.m. GMT course. You'll have another one on Thursday at 4 p.m. GMT also, which is going to be the first classroom session. This webinar is an introduction. And then we've tried to target courses always on Thursday at 4 p.m. I think on week 3, maybe there are 2 also. Sanjay, can you go to the second?
So I don't have the second slide. This is just for the reference. But these are right now the classroom sessions, although we would like to have them on Thursday, but it's still tentative because we would like to hear from everyone on preferred days and times. There is another poll coming to you in a short while to understand preferred days and times as well. So please, if you can see the poll, someone is left. So please vote, otherwise I'll have to close it. So this is the poll. Yeah, Gilles, you can go through the components as well, and someone missing on the poll, they can vote.
So yes, while we are closing down the poll, just to come back as how the course is organized. You have which is directly accessible on the Hive. In the first column, you can see on the left, you have video lessons, you have discussions, you have quizzes, you have case study, and you have resource materials. So all this, you have this pathway for accessing the video, for accessing some of the resources. You can have access to the quizzes, to the discussion. So this is something which is really the self-learning. That's where if you have any issue to access the video, if you have any issue to access the resource, please contact us. Your primary contact should be Andrea, and she will take you through the right ways to access the information you can have. Any issue you have, if you're struggling with some content or something like that, please, access us. We are here to make this course successful and valuable for you as an individual and for you as a group. So please don't hesitate to contact us anytime. Beyond this column on the left, we have those classroom sessions that we've discussed, the weekly classroom session on Zoom. So this is really something that we also value a lot. We hope we'll have, today we are speaking a lot because, well, that's the nature of the introduction on day 1, but we'll hope that in the next classroom session, you'll take really all the opportunity you can have to engage, discuss, ask questions, bring responses, answer others' questions, bring your perspective on the challenges we're trying to solve, or on the content and the competencies we're trying to develop. So that's the classroom session. And as Sanjay mentioned, for the moment, they are planned on Thursdays at 4 p.m. GMT, but we can discuss what's the most convenient time for the group. And finally, you'll have individual or group work, so weekly assignment. Every week, there is a specific assignment which is given to everyone that you have 1 week to complete, and then it's going to be reviewed, evaluated, and it's going to be part also of the evaluation and the rating for the competition. So that's basically the three main components of the course. And at the end of the course, you'll get the certificate of achievement, which is indeed showing that you've participated and contributed to the courses, and that you've successfully completed it. That will mean, ticking all the boxes of the three components that we've discussed.
Okay, just before we proceed, in the previous poll, there's one person who's indicated that they have not received the calendar. Can that person identify themselves? Who's the person who has not received the course calendar, so that we can send the calendar again? You can either put it on the chat or you can speak. And right now we're launching the next poll. There are two questions here, a preferred day and preferred time for this classroom session. So here is it on your screen. So please do let us know what is your preferred day for this session and what is a good time. So based on the majority, we will try to organize the sessions on those days. This also brings us to the first round of Q&A. We have about 2 minutes. If there are any questions with respect to the course design, the course calendar, or whatever we've discussed so far, please, this is the chance for you to speak, or you can also put your questions on the chat. Anyone who wants to speak, you can unmute yourself and you can ask this question. I would request everyone to vote so that we can have majority of people voted for this important poll. This is an important poll for us to understand the right day and right time for this session so that most people can participate because we understand time differences can be very difficult to navigate, and sometimes you are in your office, sometimes you are traveling. So we want to make sure that we choose a time and a day which is appropriate to most number of participants, because unfortunately it would be very difficult to manage time for everyone. So someone may have to wake up early, or may have to do these sessions at night, including me. So it's quite late at night in India, but we are here for you. So it depends on the majority. So there are no questions, it seems. So we'll move.
I have a question.
Yes, Shamini, please go on.
Can we get recorded sessions for if there are for the live sessions? I think that will be recorded, right? Can we get it?
Yes, so the live sessions, they're recorded. They will be uploaded on the platform. I will, in the next section, we will be talking about the course environment. So I'm sure most of you are aware about the course group, the virtual classroom group. So we will be sharing the recording in that group, most likely tomorrow. If not tomorrow, then day after tomorrow.
Thank you, Sanjay.
And so one more thing, these recordings will also be available on B-Skills YouTube channel, and they stay there for eternity. So you can always access these recordings through our YouTube channel. So I will just stop this poll for now. So it seems this particular day, Thursday, and this particular time is convenient for majority of people who are on the call. There are some people who have not joined us today. Unfortunately, it's their loss that they did not contribute to this poll. But since majority of people, they like this day and time, so we will stick to this day and time for the next sessions as well. And in future, in the next sessions, if we realize that a majority of people, they would want to shift to another day and time, then we can take a call at that time. Okay. So moving on. So the next section of the course is talking about the leaderboard and team competition. which Gilles had indicated in the beginning. So I believe most of you must have seen that as you are completing some elements of the course, you receive these points or gems. And these gems and points are also visible on your profile page. So for example, I know that a few participants like Wanjiru and Audu, they already have some gems accumulated because they have already gone through a lot of the activities of the course as per the calendar. So these gems, they are like points, and as you complete different activities of the course as per the course calendar, so you have to follow the course calendar. So if there are video lessons to be completed in a particular week, you should complete those in that particular week. If there are some discussions which are in that week, you get gems by participating in those discussions in that week itself. And then quizzes, there are certain quizzes in the course. If you score more than 85% in the first attempt, you get gems. When you submit your weekly assignments, you get gems. And when you participate in the classroom session, you also get gems. So all those people who are participating today in the classroom session, they will receive gems as well, for example. Now, every week, we look at how many gems everyone have accumulated, and we create a leaderboard. There is a provisional automatic leaderboard which is already on the platform, which I will show you shortly. But we reconcile that leaderboard at the end of every week by looking at reviewing your weekly assignments, because those assignments we review before we award you those gems. We review those case studies that you submit, and of course we will review who attended the classroom sessions, and then we will assign those gems. So at the end of every week, we reconcile this leaderboard, and we will announce the top three participants who have taken the top three positions on the leaderboard. This will happen until the end of the course. And at the end of the course, when the course has fully finished on 14th of June, the top three participants who will be at the top of this leaderboard, they will receive these prizes as you see on the screen. Since this is a learning endeavor, this is a learning system, so please don't expect any Amazon vouchers. But the prizes are more about learning more and becoming, finding ways of becoming a professional health worker as well. So we will help you enroll in some management courses, people who will be on the top three positions of the leaderboard. So position 3, that person will be enabled in a course on speaking effectively, because that's very important. When you grow in your career, you are a manager or a leader, you should know how to speak effectively in your teams, in your groups, with your patients, probably with your community as well. So that's why we will enroll you into that particular course. The person, he or she, who will be on position 2, they will be enrolled in another course on teamwork, because we feel that that's something which is very important, not just in public health but everywhere else. So that's the course that they will be enrolled into. And they will also be given a subscription to a service called Scribd. Scribd is an online service. On Scribd, you can read books, you can read management books, you can read self-help books, you can read novels if you want, you can listen to audiobooks, and a lot of other things that you can do on Scribd. The person who will be on position 1, they will receive everything that position 3 and position 2 has got. So subscription to Scribd, courses on speaking effectively and teamwork, and they will also get a free access to the next course that we are going to publish in a couple of months. So this is what you will get if you are on the top of the leaderboard. And what you need to do to be on the top of the leaderboard, you need to finish your activities, learning activities on time, which means viewing your video lessons, finishing or participating in the discussions, finishing your quizzes, attending the classroom sessions, and whatever is you see on the slide. There is also a course page dedicated to the leaderboard on the course in the introduction module. You can also read more about how to earn gems and obtain gems and be on top of the leaderboard on that page. If there are any questions, please do not hesitate to write it on the chat. We are a bit short of time, so I'm moving along. The next thing that we want to discuss, and this is completely optional and depends on what you decide today. Along with this leaderboard, which is more of a personal or individual undertaking, we would also like to introduce a team competition in this cohort. So we did not have a team competition in the previous cohort, but we would like to do this in this particular cohort. We would like to create two teams, Team Red and Team Blue. Between Gilles and I, we will be mentoring each of the teams. So let's say I will be mentoring one team and Gilles will be mentoring the other team. We have, if you agree, there is a poll at the end of this where we decide whether to go for this team competition or not. But if you decide to go for it, we have already created the teams based on different profiles of participants, so that there is a very good mix of participants on each team. All the team members, they will earn additional points when the members of their team follow the course calendar and complete their activities. So every week when we reconcile the individual leaderboard, we will also see that which team members have obtained more points in that week. And in that particular week, either Team Red or Team Blue will win, depending on the members of that particular team who have covered more activities and followed the course calendar. And whichever team wins, every member of that team will receive 20 additional gems. So which means that if your team wins, you have more chance of getting on top of the leaderboard at the end of the course. And also both the teams, they will work together in creating a 2-page report, which will be a collective report of your learning journey throughout these 4 weeks, what you learned, what are the key points which you would like to resolve in your offices, in your workplaces, or in your system, and how did you or what were the key learnings that encourage you to resolve those issues. And all these both of the reports that we will receive, they will be reviewed by us, and they will be shared through B-Skill network to everyone with your names and with all the contribution of all of you. So they will be shared with our network, with our partners, so that they also see that what are the challenges that you're facing, in your different contexts, what is the kind of learning that you have gone through in the 4 or 5 weeks, and what do you intend to do with that learning. So this is the team competition that we have created here. If you think you would like to do this, just before that, there are some key points as well. That it's another way to motivate you to get to know each other, and also to create a real team environment. And of course, the team which wins more learning weeks, their members will have the chance to finish at the top of the leaderboard. Each team will be mentored by an instructor, like I said. The final report will be published by B-Skilled, and it is not mandatory for any learner to participate in the team competition. It is your choice. Like in any team, in any group, we see that there are some people who are, they work very hard in a group, and there are some people who have a bit more individual outlook, which is all okay. Again, this is not mandatory. Even if today we decide that we're going to have this team competition, even then it is not mandatory for you to participate in that team competition. Okay, now with that, I will go to this poll where we would like to hear from you whether you would like to participate in this team competition or not. And as I launch this poll, Tanko Aaron has raised his hand. Tanko, please go ahead and speak. If you have a question or a comment, please go ahead. We are hearing you. So I've launched the poll. Please vote so that we know if you're interested or not. Tanko, do you want to speak? You had raised your hand. Okay, maybe not. Please, everyone, if you can vote. 8 people have voted so far. About 3 or 4 people, okay, 3 or 4 people have left. If you can indicate your preference, that would be great. By the time you're voting, okay, this is post poll.
And your vote will not be will not, you know, if you say I'm not interested and the team is still going on and you want to join, you will still be able to join. So yes. it's an informative.
Yes, we are not going to show anyone who voted on yes or no. Okay. Okay, so far it's been a unanimous decision. So no one has voted on no. There are 11 responses on yes. I believe there is one person who has not voted, but I don't think that vote will make any difference in terms of the results. So I will share it with you so that you all can see that I'm not lying. So everyone has voted yes. So that's great. What we are going to do now is, so this is the team that we have selected based on different profiles, different geographies, so that there's a good mix in both sides. There are 2 teams, Team Red and Team Blue. If you don't like the names, please also suggest, you can also suggest your team names. Team Red, you can suggest to me. Team Blue, you can suggest to Gilles, and we can change the team names as well. There is a message. Okay, Romeo is very happy that he is in Team Red. Okay, Romeo, we have not heard from you as well. I don't know if you sent your introduction in the chat. Please do so that everyone can know you as well. So there is a Team Red, there's a Team Blue, and there will be competition between these 2 teams. This does not mean that Team Red and Team Blue, you cannot interact with each other. You can also do that. But the way that we are creating these groups is that people within one team, they can interact more within themselves and get to know each other much better way, and also work together in different assignments as well. So Romeo, if you want to quickly introduce yourself, please, you can unmute yourself and introduce yourself to everyone. Go ahead.
That was an amazing good day.
Romeo, please go ahead.
All right, can you hear me?
Yes.
Yes.
All right, thanks. Well, I just want to thank everybody for ramping up this initiative. I think we were the 2nd cohort, and I'm very excited to be part of this training process. I'm currently working as a supply chain manager, a project manager of a supply chain for health in El Salvador. We're preparing some components for a emergency response project, as well as a support initiative to primary care level facilities in El Salvador. So this particular training is going to help me a lot to improve my skills, to obtain a lot of help in terms of information. We are also implementing trainings here, and this information is going to be very helpful. I really hope that we can share best practices and information around what's being done around the world. Thanks for for launching this particular meeting. El Salvador.
Okay, that's great. Thank you so much, Romeo. It's really good to hear from you, and we expect to hear a lot from you throughout the course as well. So moving
Sure
on.
you will.
Yeah, moving on, everyone. If there are any questions about the previous section, please you can put it on the chat. We will create additional subgroups for both the teams, and we will give you an entire guidance on how to interact within your teams and in the broader course group as well. Now, without wasting a lot of time, let me now go to the live tutorial as well, because some of you may not have fully understood the course environment, and we would like to show you key sections of the platform so that it becomes easier for you to navigate as well. So give me a moment and I will share my screen and show you the course environment as well. Okay, so here it is. Please, Gilles, is it visible now?
It is, yeah. It's okay.
Okay. So I'm logged in using a fictional user. Please, if you see this name and person on the platform, please don't send any connection request. This is a fictional person. This person will not respond you back. Now, this is your personal dashboard on the platform. Okay. As you log in, I believe everyone knows how to log in. As you log in, you always come to this dashboard, which is like your personal space. Here you get these quick links to go to these four key areas of the platform. Whichever course that you are enrolled in and you are going through the course, you see the last lesson or module that you are going through here. If you were participating in any forums, you will see those active forums here. You will also see what else is happening on the platform itself. So for example, I can see here that Yunwen is currently online on the platform. So I can see because there's a green button or a green circle in front of his name. I can also see that Terence, who's not with in the session today, he has submitted a discussion response. Audu has submitted a response, and so on and so forth. So this is your personal dashboard. Now from here, you can go to your profile, you can go to discussion forums, you can go to the main activity feed, or you can also go to the courses. Now let me start with the profile. I would expect everyone who's part of this course to have a profile picture. Now, when you click on this link here, which says profile, or you click on this drop down and click on this profile button here, you come to this profile page. To change your profile picture, you just have to click on this button, which says change profile picture, and then you upload your picture on the platform. Similarly, you can also upload a cover picture. This is called a cover photo. Now, cover photo is something like, which you want to show to the world, your beliefs or what you care about, maybe something professional, it's up to you. This is exactly like you do on Facebook as well. So that this is not something very new. On the profile, you also see the number of gems you have, the number of points you have, and then once you finish this course, you will also have CPD points as well. Okay. Then there is a button here which says achievements. Once you finish this course, you will also see a CPD badge under achievements here. Right now, Rahul does not have this because he has not completed this course. Okay. Then you can go back to your dashboard. Then you can go to discussion forums. You can go to groups. Let me start with the group. So if I click on this, so I will come to this groups page. Okay, maybe it's something is wrong here, but what I want to show you is, okay, it's open now. Okay, I'm sorry, something is wrong here. Okay, now it's working. So these are the various groups which we have on the platform. There are some which are public groups like the Community on Supply Chain for Health, Community on Universal Health Coverage, and Fighting COVID. These are public groups and anyone can become a member. The Collective Learning Group, this is a classroom group, and I will talk more about it because this is more important for today. As you enter, you see something like this. So this is a classroom environment for everyone. Here you can see these tabs: members, feed, discussions, course, photos, albums, documents, and Zoom. If you click on members, you see all the participants of this course and of this cohort, and you also see the participants of the previous cohort. We have not excluded them because they're part of this journey, they're part of this learning exercise, so that you can also interact with them. As you go through the members list, you can follow different members. Uh, you can also connect with them. Unfortunately, for this user, this connection is not coming, but I'm sure for you, you will see the connection request. There is a connection button which you will be able to find here. And after you connect with people, you will also be able to message them. So there is a private message option which is there, and when you receive messages, you see it here, just like Facebook. So you receive messages, you see on your top bar as well. And if you are involved in any activity, you get notifications as well, which you see in the notifications panel. On the group feed, so this is like the common area of the group where you see whatever is happening on the course, which member is responding to a discussion. If someone has uploaded a picture, you can see that. For example, it also shows you notifications for the classroom course. So this is the notification for this classroom course, which is ongoing right now. You can also ask questions. You can also write anything here. So it says share something with the group. So if you have a question which you want to ask the group, you can type it here and everyone in the group will see it on this feed. Okay. You can also share pictures. You can attach pictures. You can also attach documents. If you want to share any documents with anyone, you can also attach here. Okay. Then there are something called discussions. Let me see if this is already open. Okay, no, it's not open. But there are discussions on this group as well. Some discussions are linked to the course. This is the course here. I will come back to discussions in a while. This is the course environment. As you click on the courses tab, you will see Collective Learning 1. As you click on Collective Learning 1, you come to this course page. Here is the preview video of this course. And here you see the course content for every week. So this week, week 1, module 1 and module 2 are open. Week 2, these two modules, then week 3, week 4. You also see a small calendar for every week, that what is happening in that particular week, so that you know what are the critical activities to complete in that particular week. And this is also the same as you see on your course calendar as well. Okay. And then you go one by one. You finish your learning videos. You finish your so for example, this is you come here, you see your learning videos, you see your discussions, and you can participate in the discussions right from the course itself. So this is a discussion, for example. If you want to write a response, you can click on this button named reply, and you will be able to post your response here. You can also see these discussions on the discussion tab in the classroom. So for every week, whichever discussions will be open, you will find them here opened. The ones which are logged, they are for the next weeks, so they are not opened yet. Okay. In the next weeks, we will open those discussions as well. So you can write your responses either here. So it's the same discussion, for example, participants' expectations, and it's the same discussion here as well. So you can respond from either places as well. Okay. Then this is the provisional leaderboard that I was talking about. This provisional leaderboard is visible. The link is here. So it updates automatically as you go through the course. So here is the link. So Rahul Mishra unfortunately is not ranked because he hasn't done nothing. But if you if you finish your activities, you will see your rank here. And as you will click on this link, you will see this page. Right now, for example, as of now, at this moment, 10 is leading. He has 19 gems. And then there is Audu, there is Bikala who are behind 10. But as people start to finish their activities, we see a lot of excitement on this leaderboard as well. So this is the overall course environment and the platform for you. There are some other pages that you can explore. There are some other groups. There are some discussions which you can explore. There are some blogs which we keep on writing every now and then. You can also read our blogs. Do comment on them so that we know what you think about those issues. You can also see all the members on B-Skilled. So we have more than 550 members, or rather 573 members on B-Skilled. And like I was talking about, there is this connect button. You can connect with, so for example, if Rahul Mishra wants to connect with Anfor Wilson Ghani, he will just click on this connect button here. And then Anfor Wilson Ghani will receive a connection request. And when he accepts, then there will be a message button which will be visible here. And then both of them can interact privately as well. Okay. So you can see all the members who are, in this platform. You can filter by countries. For example, if you want to see who all are from Nigeria, you can write Nigeria here and search. You will see all members from Nigeria. And similarly from any other organization. If you want to search with a name, you can also do that. Okay. So this is the entire platform for you, and the course environment and the classroom environment. Every week, you will find the classroom session links here on the Zoom tab. So for example, it is right now showing the link for the next Zoom session, which is on May 20th at the same time. You see it's one day, about 2 days away. Okay. So you can join this meeting directly through this link, which is here. Okay. So you don't need to log in anywhere. You just need to log in on the Hive and you will see this Zoom link for the session. So I will just stop here. There were a couple of chats which were coming. Let me see if, okay, I can't see them. I have to stop sharing probably. Okay. So right now, let me go back to my session. And if there are any question that you have, please, you can ask them right now. I'm launching the last poll of this session so that we know that you have understood about this platform and the course. And then from there, if there are any questions that you have, please ask them now. Otherwise, we will close this session for today, and we will meet you in a couple of days for the first technical session of this course, where we will learn more about various stakeholders in supply chain. So I will just pause and hand it over to Gilles. Gilles, any final thoughts? If there are any questions, then we answer. Otherwise, please, if there are any other thoughts, over to you.
No, thank you. Thank you. Thank you, Sanjay. Thank you, everyone, for participating. Sorry for being, we are a bit late. It was the first day, so let's take it as an exception, because usually we really try to be, to start on time and finish on time. I think it's what is expected from all of us. So anyway, thank you very much, all of you, for participating. Thank you for being very active on the chat, and also in intervention, and showing the video. And we are all going through strange times those days. So the more we can see faces, I think the better it is. We are going through times where sometimes we don't have to meet. We cannot meet with others for some time. And I know a meeting on Zoom is not as fun as meeting in a classroom, but at least it gives us the opportunity of interaction and things like that. So please, every time you have the chance to show your video and speak, really, this is the kind of interaction we want to see. I see some suggestions also about the team, the colors and the name for the team. So yes, let's try to work on that. Maybe we can think about creating some ways of a group to communicate and exchange information. So please, thank you. Let's stay tuned and looking forward to speak to you on Thursday. If you have some questions, some clarifications, please keep them, and maybe we can discuss that on Thursday. We'll have the opportunity to meet again face to face. So looking forward for that. Thank you very much. Very happy to have this cohort with us today. So very nice to see you. Very nice. This variety of profile from a variety of countries. It's a real asset, real riches. So thank you.
I believe there are still a couple of people who have not voted. Please, if you can vote, it will be great. Otherwise, that will be the end of the session. If there are no other questions, if anyone wants to say anything to the team, the entire team, please, this is the right time. You can say a few key points to everyone in the team, or otherwise we will just close this session. So I'm just ending the poll right now, and we'll share the results here on your screen. So it seems that majority of people have understood how to connect with everyone, the groups, discussions, private messaging, course environment, gems and points, and of course they understand that they would have to participate in all the Zoom sessions. That's great. If still there are any issues that you face with the environment, because we think that this is a very new course environment that you may have seen, please don't hesitate to reach out to Andrea for any issues with the platform, or if you have any issues with the content, please do reach out to Gilles and myself. Andrea, any last words before we wrap up?
Yeah, no, I think this was a really fun session, and I actually did not know what is the maximum number of gems that you could get.
Yeah, we need to figure that out.
Thanks for clarifying that, Sanjay.
I'm sure, with the group work, some people will find a way to get even more than the maximum.
Exactly.
We'll trust Team Blue, for instance.
Yeah.
We'll see about that.
We'll see that, Sanjay. We'll see that, Sanjay. I wish you good luck anyway, Sanjay.
You too. All right. Thank you everyone for joining. We wish you good evening, good day, good night.
Good evening, everybody.
See you all on the platform, and then in a couple of days.
Good night.
Bye, everyone. Take
Thank
care.
you.
Good night.
Good
night. Bye-bye.
Be safe.
Take care. Bye.
Bye. Bye. Thank you.
Bye-bye.
Bye. Bye. Bye.
Say bye-bye. Bye-bye.